maybe I'm just naive, but I would have thought when that story broke this week and we found out about the beginning of infections there, that I would have thought the vast majority of staff at that facility would have been jabbed by now. Is it my naivety or is it a surprise?
You would absolutely think that, and that's what we wanted to see happen. This goes back to an issue with the vaccine rollout, another issue with the vaccine rollout. So initially, aged care workers were priority 1A in residential care, so they were listed as a priority, which was right. They were supposed to all be vaccinated in reach between February and by the end of March they would have been vaccinated. That was the Commonwealth Government's plan, which we supported. That's not how it rolled out, though. So staff weren't vaccinated, residents were vaccinated in the facilities. And we have been discussing with government ever since about making sure that the workers do get vaccinated. So it's really clear to understand that that was the plan. It didn't happen. There have been bumps along the way. And as a result, aged care workers haven't had the priority that they absolutely should have had, and they should be vaccinated by now. I agree.
OK, let's dig deep as to why this has occurred. New South Wales government offered months ago to do the work of the federal government and go and vaccinate those workers. But the contractors employed by the federal government had just said, no, we can do it, and they haven't achieved what they said they could do. Is that what this is about?
So I don't know all of the backstory about the state and the federal, and, you know, our absolute concern is that our workers get vaccinated. So, as said, I don't really, in that sense, whether it's state or whether it's federal, the key thing that we have to focus on is getting aged care workers vaccinated, and we're still not there yet.
Yeah. What about, I was astonished also to hear the COO of Summit Care praise her staff for working whilst unvaccinated. That kind of approach needs to change, doesn't it, until they're all vaccinated?
Well, I think we've only just had the decision the federal government announced last week about making it mandatory for aged care workers. So it's only been introduced very recently that it is mandatory. Otherwise, it was voluntary as for the rest of the population. And we as providers were working with staff to try and get them vaccinated. I think we've seen issues with the rollout generally, and the aged care workers are no different. So it has now been made mandatory. In our view, that's a good thing. And we now need to make sure that we make it as easy as possible for staff to be vaccinated. They need to be a priority wherever they go, but we do think the best way to get them vaccinated and the easiest way to get them vaccinated and get the coverage that we want is if it's done in the facilities as the residents were done.
Yeah, just in terms of the residents, no doubt the first run of vaccinations would have reached most residents in aged care facilities, but each and every day, as you know, there are residents who have gone to hospital, gone to the doctors, gone to appointments, and then they've got to come back and do it all over again. There will be people that they miss, but at least those who are vaccinated, it seems they're showing no symptoms out of the Baulkham Hills facility, and the vaccination actually does work.
Yeah, and that's a really good sign. And can I say to those residents and their families and the workers, you know, we're thinking of you and we're hoping that you return to full strength as soon as possible. We are doing everything we can to try now to make sure that this vaccination happens. And as said, that the conversation about it being mandatory has been happening since early in the year. It was our position in January, and the federal government has just announced that. And now we are working really hard to try and ensure that the rollout that happens, that the federal government's rolling out, make sure that that workers are actually the priority and get vaccinated really quickly. And it's as easy as possible for those workers to get vaccinated.
And what's your message to those who are running aged care facilities who seem to be hitting brick walls with when the next team is coming to vaccinate their staff? Should they contact you? Should they ring a hotline? Should they scream loud on Sky News?
They do contact us, our members and not-for-profit providers right around the country, but we're working with all of the aged care providers. We want to make sure they need to talk about what their issues are, and we are talking to the government and working really hard to try and make sure that this issue is addressed and that our workers are vaccinated and supported with good information so they can understand and make the decisions that they need. But that's absolutely our focus and our members' focus. Let's get workers vaccinated and let's make sure it's as easy as possible for them to do so.
Where are we up to in terms of a pay rise for aged care workers, which of course was recommended after the Royal Commission? I understand the ask is for 25%. Where are we up to? What's government offering and where will it end?
So there is a process in place through Fair Work Australia, which is a work value case, and that will look at what the pay rise should be. What we are saying as providers is it's absolutely, our staff do an amazing job. They are underpaid. We need more staff and we need to pay them better. We can only do that if the funding that we receive takes account of paying staff that. The government put a good package in place in the budget that's is providing additional funding over the coming years, but it doesn't actually include funding for a staff uplift, and that's something through Fair Work that we're going to need to look at. They do a great job and they need to be paid more, but we need support to be able to do that.
We'll watch that space. Patricia, Sparrow, thank you very much for your time.